Stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across this country demanded change, and we are delivering it. We're ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of the American people first. President Trump and I are challenging the status quo and the institutions that...
What happens when the person running the most powerful health agency in the world walks into Congress and says the system itself caused the damage?
Mr. Secretary, we turn it over to you for your opening statement.
Chairman Crapo, thank you. Ranking Member Wyden and members of the committee, thank you for the opportunity to appear before you today to discuss President Trump's proposed 2027 budget for HHS. First, I'd like to take a moment to express my deepest condolences to your colleague, Senator Mark Warner, over the recent loss of his daughter, Madison. My thoughts and prayers with him and his family. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across this country demanded change, and we are delivering it. We're ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of the American people first. President Trump and I are challenging the status quo and the institutions that defended as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated the most favored nation drug prices with 16 of the largest pharmaceutical companies so that Americans no longer pay more than other people in wealthy countries for the exact same medications. We're bringing real transparency to healthcare pricing so that patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization, and I brought the 400 largest tech companies together to end information blocking.
That gasp tells you everything. RFK Jr. just announced that over 50 medical schools agreed to expand nutrition education from 2 hours to 40 hours, and the room reacted like he'd said something dangerous. That reaction is the story, because if fixing what doctors are taught about food is controversial, it tells you exactly who benefits from keeping them uninformed. The food industry funds research, pharmaceutical companies fund medical schools, and the federal agencies that were supposed to stop this spent decades looking the other way. What you're watching isn't just a budget hearing, it's a man inside the machine trying to dismantle it with a microphone and a podium. The question nobody in that room wants...
So for the first time, Americans will be able to get their own health records, which they own, on their cell phones. We are cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry has committed to phase out petroleum-based dyes by the end of the year, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families, driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harms. We're eliminating outdated and misleading warning labels on hormone therapies used by women during menopause. We're strengthening oversight of organ procurement. We are regulating television advertisements for pharmaceutical industry, something the Democrats have been asking for generations. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying that same focus and urgency to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years, to strengthen rural hospitals and ensure Americans can access the care they need no matter where they live. HHS has also last week announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear. When physicians train in rural communities, they're far more likely to stay and serve there. The president's budget puts all these priorities in action. It invests in prevention because preventing disease costs less than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word. Change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. The resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity, to implement and codify lasting generational reform in American health care for our country, for our children, and for the health of the American people. Together, we can make America healthy again. Thank you, Mr. Chairman.
Thank you, Mr. Secretary. And
He didn't come to negotiate. He came to indict. Not one person, not one party, the entire system, the agencies, the food industry, the medical schools, the pharmaceutical supply chain. RFK Jr. stood in front of the United States Senate Finance Committee and said out loud, on the record, "We did this to our children." Decades of captured agencies and profit-driven systems built the sickest generation in modern American history. And the room gasped, not because it was false, because it was said. There is a specific kind of silence that falls when something true and forbidden enters a formal space. You heard it 3 times in that hearing room. Once when he named the failed policies. Once when he named the captured agencies. Once when he said 50 medical schools had spent generations teaching doctors 2 hours of nutrition. 2 hours. To treat a country where chronic disease is the leading cause of death, the leading driver of healthcare costs, and the defining health crisis of the last half-century. 2 hours. That number alone should end the conversation about whether the system is broken, but it won't, because the system is not confused. It is functioning exactly as designed, for the people who designed it. But here is what nobody is asking. If RFK Jr. is wrong, if the food dyes are fine, if the dietary guidelines were always honest, if the prior authorization system was never the problem, then why are 40% of food manufacturers already voluntarily phasing out petroleum-based dyes? Why are the insurance CEOs suddenly at the table? Why did it take a political outsider with a controversial history to convene the conversations that career health officials never managed to start? The cynical answer is optics, that this is performance, that nothing structural will change because the financial relationships between industry, agencies, and Congress are too deep and too old to be disrupted by a Senate hearing and a budget proposal. The optimistic answer is that visibility matters, that naming the problem on record in a formal hearing with cameras running creates accountability that did not exist before, that the gasps in that room were the sound of a conversation finally being forced into the open. Both can be true at the same time. Think about what this means if you are a parent who has spent years watching your child cycle through diagnoses, medications, and specialists, and nobody ever asked what they were eating. Think about what this means if you are a physician who went through medical school and genuinely received 2 hours of nutrition training and never questioned it because the curriculum never signaled it was a gap. Think about what this means if you are a pharmaceutical executive watching a cabinet secretary stand in front of Congress and call your industry's relationship with federal agencies captured. The word he used was captured, not influenced, not cozy, captured. That is the language of systemic failure. That is not a policy disagreement. That is an accusation of institutional corruption dressed in the formal language of a budget hearing. Why now? That is the question. The timing is not accidental. This budget proposal drops $50 billion into rural health infrastructure, pushes drug pricing reform through most favored nation agreements, and attempts to codify MAHA, Make America Healthy Again, as a legislative framework, not just a slogan. If it passes, or even if pieces of it pass, it restructures the financial incentives that have governed American health policy for decades. That is not incremental reform. That is a reorientation. And the forces that benefit from the current system know it. The gasps in that room were not just surprise. Some of them were the sound of people calculating what this means for their industry, their funding, their relationships, their relevance. History offers a parallel worth sitting with. In the early 1970s, the Senate Select Committee on Nutrition and Human Needs, the McGovern Committee, held hearings that eventually produced the first federal dietary guidelines. The food industry fought them. The medical establishment was skeptical. The guidelines that emerged were compromised, watered down, reshaped by lobbying. And the version that reached the American public was not the version the science supported. 50 years later, RFK Jr. is standing in front of a different Senate committee saying we are flipping the food pyramid upside down, and the room is gasping. The pyramid was wrong for 50 years. Everyone in that room knows it. The gasp is not ignorance. It is the sound of an institution being asked to admit it. Whether this administration follows through, whether the budget survives, whether the reforms hold, whether the most favored nation drug pricing survives legal challenge, whether the dietary guidelines actually shift behavior at the population level, none of that is settled. None of it is guaranteed. The gap between a Senate hearing and a structural change in American healthcare is vast, and the graveyard of reform proposals in this country is deep. But something happened in that room that does not get walked back easily. The Secretary of Health and Human Services stood before Congress and named the system as the cause. Not foreign actors, not bad luck, not individual behavior, the system, the agencies, the industry relationships, the curriculum, the guidelines, the incentives. If he is right, the implications are generational. If he is wrong, the question is why so many people in that room, and outside it, are not rushing to prove it. That silence is the story. That silence is what you should be watching. This story is not finished, not even close. If this is the analysis you are not finding anywhere else, you already know what to do. Subscribe, share this with someone who needs to see it, and drop your thoughts in the comments, because this conversation is just getting started. Thank you for watching.